Today's More is about more than just learning. It's about building confidence, awareness, and the ability to take action when it matters most. Every day in our job in healthcare, we see firsthand how preparation changes outcomes.
Show of hands, who's here because your parents made you be here? You can be honest, this is a safe space. All right.
Today, you guys are gonna learn something extraordinary. You're gonna learn things that most of your friends that are home sleeping, that didn't wanna get here, can't do. And God forbid that there is a tragedy. God forbid that there is something that happens. You now are that extraordinary piece. That extraordinary piece of a puzzle. Because each one of you guys plays a significant part in community, plays a significant part in your environment. But without you, and without you, and without you, anybody's ever put a puzzle together? Jigsaw puzzle? If you're missing one piece, is it complete? No. You are that piece of that puzzle to change community. You are that piece of that puzzle, whether you're in your household, whether you're in your school, whether you're in your neighborhood, that piece that changes all of this.
This youth preparedness is going to give all our explorers an accommodation board that we were looking for to give our explorers.
We're gonna learn how to do stop the bleed. We're gonna learn how to wound pack. You're gonna learn how to use a tourniquet if absolutely necessary and you have to save your life or a loved one. It is important to know bleeding techniques. And then at the end, we're gonna learn the difference between cover, concealment, and what to do in case of an active violence or active shooter. Again, it is not intended to scare you. It is made to make you more aware and empower you to know how to respond to these situations. In front of you, you have gauze and you have a styrofoam. Look for the opening on the styrofoam. It's a slit on the side. My instructors, if you can go around and make sure that everyone's doing it properly. Show me how you would wound pack. Very good. So take the tourniquet. Open it up. If you are able to do it on yourself, let's do our left arm first. If not, you can take the styrofoam and use that as a limb, and you can do it on the styrofoam. Again, I'll ask my instructors to go around and make sure that everyone's doing it properly.
I feel like this program is really good to educate our youth. We know a lot of things are happening right now, unexpected things, and it's very good to be aware of what to do no matter how young you are.
These situations, like emergency situations, they tend to happen like anytime.
I achieved awareness for emergencies, especially in New York City and in Brooklyn, you know. Unexpected events happen, and preparedness for that is really, really welcoming.
Spending most of my life in healthcare, understanding, seeing how people's lives get saved is really important. And people don't think it's a sexy job, it's not a lot of money, but I tell you, Jennifer, that level of caring for community is important. So for me, this is just encouraging. Like seeing you have a full room of students who are taking notes, ready to understand what healthcare really means to community is important.